Let's move over to this now. World-renowned cardiologists are bringing their expertise to South Africa next month. They'll be participating in the SA Heart Association's annual Congress, which takes place at the Sandton Convention Centre from the 27th to the 29th of October. Now, this event is under the theme Cardiac Collaboration, which will boast joint conferences in highly specialised fields such as cardiac anesthesiology, endocrinology, and critical and emergency care, sports medicine and radiology. For more on this, we're joined by Cardiologist and Wits University lecturer Dr Farouk Mamdoo. Thank you very much for your time, Dr Mamdoo, and I wonder if you can hear me clearly, and if you can, just give us a sense or more details around this particular conference, and really just the kind of learnings that you are hoping to get as an industry, a critical industry in this day and age.
Thanks very much for the invitation. I can hear you quite clearly. This year, this is the 23rd Annual Cardiac Congress, or Cardiology Congress. It's hosted at the Sandton Convention Centre at the end of October. This is a very unique Congress. Obviously, cardiovascular medicine is advancing at an alarming rate, and cardiovascular disease is now the largest burden or prevalent disease worldwide, whether you're in a first world or developed nation or developing nation. Cardiovascular disease, unfortunately, is one of the most prevalent diseases. With that, there's come a need, obviously, to keep up with most of the innovations that are developing all over the world. And cardiology in South Africa is by no means behind the curve, so to speak. We have a large number of very academic, very high-level profile local cardiologists, but we've always maintained a very high standard by maintaining links with international societies and experts across the globe, where we often collaborate on various research projects, sharing information and learning new techniques from each other.
And how do those new techniques then weigh into what you've just mentioned there, that it's become one of the biggest burdens when it comes to health and health issues, not just in South Africa, but across many parts of the world? The different learnings, which would include technology and innovation, and the role that that can play in curbing the scourge of what you say is a growing issue when it comes to health.
Correct. I think one of the biggest constraints, I would say, is that there are numerous resource limitations. South Africa is no stranger to that. But clearly, there are a need for a large number of cardiovascular patient beds, which is, of course, in large demand. We have a very fragile infrastructure, a limited number of specialized beds available for cardiovascular patients. So there's a massive need to get these patients in, treated efficiently, quickly, for where they can recover, and then, of course, vacate those beds as soon as possible. The longer the stay in hospital, of course, the higher the rate of complications, and the need to manage these patients in a very efficient way, where they can come in, whether they come in electively or in an emergency setting, get superb care, and then be well enough to vacate that bed and go home and recover. That's sort of what's driven a lot of the innovations. Also, what's happened is that we know that performing complex surgery on patients' hearts, with usually in the old days we'd have to stop the heart or rest it so that we could work on the heart. Today, many of these innovations have moved in this phase where we can work on the heart to fix the heart without stopping it, or even sometimes cutting open the chest. So that's in the realm of what we call minimally invasive corrective surgery, which is the realm of cardiology. And as these devices or tools or scientific progression has improved, there's a need to keep up with that. And that's what this Congress is aimed to do. And also to bring in many of the other disciplines, so as you mentioned earlier, the endocrinologists, the critical care specialists, the emergency medicine practitioners, the anesthesiologists, who often collaborate with us on an ad hoc basis, but to get them involved in a more academic setting, so that we can share the innovations that have occurred and allow them to then help us develop further techniques to get these patients treated more adequately or efficiently without keeping them in hospital too long.
Now, conversations of this nature with specialists that you've just mentioned, I assume cannot take place without the voice of government and related stakeholders. How important is their participation in a congress of this nature, particularly as we look at issues like NHI and the like, where government wants to take on the bulk of healthcare services and, of course, ensuring that they're giving quality healthcare in that regard?
I think it's a very important question you're asking. I think any attempt to manage such a large burden of disease without without being aware or being or fair with the latest techniques and scientific updates would be a futile exercise and very inefficient exercise. So I think it's very important. We have a specialized tract that is occurring, or session, a joint session that's occurring during our Congress, where we're looking at things, for example, artificial intelligence. We've also asked many of the stakeholders, as you mentioned, involved in cardiovascular care. We've got Dr. Nicholas Cripps, as you know, who's involved quite heavily with the NHI implementation. We've got leading experts, or I would say chief executive officers from the various medical schemes as well. And we're bringing in device and pharma companies as well, all to speak about these very challenges, as you mentioned. There's a need to collaborate. We cannot work in isolation. Whether you work in the private sector, or you're in the private sector funding models, or the government sector or the state sector, there is no way that these can be divorced from each other. There is a need to find a solution, to come together. And this Congress is one of the congresses, or one of the meetings that are trying to highlight and sort out these challenges that we may be facing.
At a higher education institution of learning, Doc, are you finding that those that are studying medicine are taking up specializing in cardiology as something to move on from a general practice standing, or are people looking towards other specializations based on just what you're seeing?
Well, it's my job as a lecturer at university to attract the medical students to join cardiology. We are only 150 cardiologists in South Africa, a country of over 60 million people. As I said, the largest disease burden is in the cardiovascular space. So we're really not enough cardiovascular or cardiologists practicing in the country. There's a need to have more students from the level of student to those that have now qualified and are wishing to or seeking to specialize, to venture into the cardiology space, because we're going to definitely need the help, all the help we can get.
Now, you mentioned something a little bit interesting earlier, Doc, in terms of the aftercare and making beds available. And I was just wondering what causes bottlenecks in that aftercare process that you're finding people having to spend a lot longer than they probably would need to in a bed after a surgery, invasive or otherwise?
Correct. Well, in general terms, although it's not completely obsolete, invasive surgery does lead to a patient staying a bit longer in hospital. There's more recovery that's required, or a longer road to recovery, I would say. Cardiology, unfortunately, is not that kind of speciality where everything is planned or elective. Patients come in at any time of the day in the emergency setting that require complex interventions, whether they're invasive or non-invasive. And the idea is to be as efficient as possible in getting these patients adequately treated. You can't treat them halfway. You've got to treat them completely from start to finish before they are able to go home. So the need to then have a system in place with a number of experts as well as resources, structural resources in place is definitely there. And this Congress is aimed at bringing those innovations, which are sometimes available all over the world and sometimes not available here, but to get our cardiologists up to speed with some of those developments. We've already adopted, I would say, for example, our routine angiography that we used to do through the femoral artery or through the groin. 99% of them are done through the wrist, or where the patient can literally get off the table and walk around with a little bandage on their hand, like a watch wrist band, and ambulate immediately after the procedure. So it's these kind of it appears simple, but they actually have a massive impact on outcomes as well as efficiency.
And then finally, and very briefly, if you would, Doc, the issue of power cuts, is that going to be part of the discussions in this Congress? It may not be something that's felt by many other countries around the world, but certainly it's become a huge burden for South Africa and the healthcare system. Is that something you're going to be touching on?
Yes, I think as I mentioned earlier in that earlier segment, we're looking at all the sort of challenges and the reasons for some of these challenges, as you know, are power or energy related challenges and how to streamline those avenues. It's not something we can solve at one Congress, but at least it's a start where we can bring these people in and get them to hear our voice and our appeal that this is a forewarning of what's to come. Cardiovascular disease is exploding, I should say, all over the world. And South Africa is by no means spared from this onslaught or this burden. And there's definitely going to be a need where the efficiency levels or the care afforded these patients in hospital settings or even in the outpatient setting is largely dependent on energy availability and efficiency there. And so, of course, addressing these sort of technical issues or political issues, as you were, are definitely something that we'll be opening up the channels of communication to.